Good morning, everyone, and welcome to our April webinar on mental health, recognizing and responding to mental health challenges. We're glad you're all here with us this morning. Go to the next slide for me, Connie. We'd like to thank our partners. They help us provide these webinars to all of you. We'd like to thank TSSA, MPMA, SCSA, BIA of the Red River Valley, ABC of Minnesota and North Dakota, NRASP, Build Connection, and the Lake Area Manufacturers Alliance. Thank you very much for your support and helping us to promote these webinars. OACS is your total safety solution. We provide safety consulting services for small and mid-sized manufacturing and construction companies. And so if you have any questions about services or need any help, please reach out. We've got our Twin Cities corporate office and our Fargo office as well, and we're here to be a solution for you. Your involvement in this is very important. If you have any questions throughout the presentation, please put them in the chat. I will be monitoring the chat and possibly interrupting Connie if there's anything that might apply at certain points. And then we will have some time at the end as well. If it's very personal, very specific, we might not cover it right now during this webinar, but we will make sure to get back in touch with anyone who has a question we're not able to answer right in this session. We're not going to share the PowerPoint presentation, but we will have the recording of this video on our YouTube page and our website by tomorrow or early next week. So please look for that if you can't stay and watch the whole thing. So we do have some specific learning outcomes for this webinar. We want you to understand the importance of mental health in the workplace and its impact on well-being and productivity. Recognize warning signs of mental health challenges in yourself and your colleagues. Learn effective strategies to get support or provide support for colleagues experiencing stress or crisis. And then develop skills to foster a supportive and stigma-free work environment. We are very proud to provide continuing education units for this webinar. There will be 0.1 CEUs awarded to anyone who needs them. Tomorrow you will receive an email with an assessment and an evaluation. After you complete those things, we will award you that 0.1 CEU. If you have any questions, you can let me know. I'm Jennifer. My email's right there on the screen. And with that, I think I'll let Connie take it over. I think it's your turn, Connie, right, to take it over and let us know about mental health challenges in the workplace.
Sounds great. So, hi, my name is Connie Van Ralt. I have been in industry for about 20 years, also helped in some construction areas as well. Also have been an EMT. So I see mental health from a human resources safety position as well as from an EMT position as well. So my goal today is to be able to help navigate and look at, what can we do in our businesses to really make mental health and mental health challenges reduce the stigma and make them something that we can have a conversation about and then work to, resolve or help each other work through these different situations. So my first situation, whenever I'm looking at this, is, what is mental health or what is good mental health, and how would you define that? So the World Health Organization defines mental health as a state of well-being in which people can realize their own potential, cope with the normal stresses of life. So we will have normal stresses. This is just we should have, as long as our mental health is in a good spot, an ability to cope with those things. We can work productively and we can contribute to our families and our communities. So really looking at that of social, emotional, and psychological overall being strong in those areas. I've been in industry for 20 plus years, and I can tell you that there was a point in time when I was trained in and when I went through college, they talked about, we need to train our employees that as soon as they touch the door handle, that they need to leave their personal lives outside of the business, and that is where that crossover happens. That has not suited us well over the last 20 years. And the reality is, no matter where we go, we're going to bring our whole selves. And that includes our emotions, our experiences, and our mental health. Just coming to work doesn't make those home challenges go away, and vice versa. Going home from work and being at home doesn't always make those work stresses go away either. We are going to show up with those, and we need to figure out how can we do something different, or how do we navigate when that's what's going on. Is this a really big problem happening in industries right now? It absolutely is. General industry and construction. If you look at the overall deaths that are occurring, fatalities that are occurring in workplaces, I know in 2023, the number was 5,283 fatalities. But about 120,000 deaths per year are caused by workplace stress. So that number is astounding to me, that this really is. I know in construction, we talk about fall protection being number one and being the number one cause of death. And in reality, it is mental health and mental health challenges. OSHA is coming out with statistics and doing training for people as well right now. And we really need to focus on this, as it is something that is taking more lives than other ways that people are dying in workplaces. And these things are things we should be able to do something about. So 75% of adults in the US are reporting stress or symptoms of stress throughout the last month. 33% of adults are reporting extreme stress. 50% report that stress negatively impacts their personal and professional lives. And just in construction alone, it is 5.5 times higher in 2024 numbers, 5.5 times higher than any other construction fatality number. So when we do look at those falls, and we do look at things that we've heard continuously through the course of time of what's causing fatalities and trying to shore those things up. The biggest cause of fatalities right now in all workplaces is mental health, and the cause of stress and those symptoms that come with that. So it is something we need to act on, just like we're putting people in harnesses and looking at our fall protection procedures. How are we handling and navigating through mental health challenges? Because they are prevalent and they're everywhere. There are people on this call and in every room that I've ever trained that are struggling with different things, or have different circumstances going on. Many people are doing this by themselves without you knowing about it. It could be high pressure jobs. They're feeling overwhelmed. It could be they're living in an unsafe neighborhood, or they don't have good housing, or they are working long hours, which is causing them additional stress, or they're working away from their family and moving around the country to help, with businesses. In both cases, construction, general industry, including manufacturing, healthcare, warehouses, we have a tendency to work a lot of hours, especially going into our busy seasons. So we see these symptoms or these situations that are occurring, and we need to understand that we might not know all of this, but these things will impact people's mental health. And just because we don't know, we need to take that time and get to know our employees, get to understand what's really going on, and ask those questions before we're going down that rabbit hole of, well, we're just going to write you up. Like, what is really truly happening? Mental health is not a one size fits all. Again, people are going to show up with their experiences. They're going to show up with their past. They're going to show up with how they've managed this in the past. And each one of us are going to deal with stress in our own way. Each one of us are going to look at a situation and be reminded of a situation or something that maybe occurred in our previous worlds, and may react in that same manner. Onlookers often don't understand how each one of us would look at stress. Somebody could say, hey, Connie, that's not really that big a deal. I know I had in my lifetime, I had a coworker that her goldfish died, and it was like the end of the world for her, and that she was so upset about this goldfish that had passed away. And in my head, I was thinking, is it goldfish? Don't they die? Like, that's what they do. So she was quite upset. I did not understand or grasp her concern or her feelings for that goldfish. So in all cases, there are going to be situations just like that goldfish where you're not going to understand why someone is reacting the way they are, and why you would react a different way. We have to be able to adapt and help that person where they are and meet them where they are. The reason mental health at work is such a big concern, or such a conversation that we need to reduce the stigma around it, is that a lot of people spend a lot of time at work. Most of us spend more time at work than we do in other parts of our lives, with our family, with our loved ones, with our friends. Just due to the amount of time we're spending together, colleagues can often see things or notice different symptoms of stress, or as stress continues and gets into crisis situations, you can see those things more frequently than maybe even their loved ones, just due to the amount of time you're spending. You also share your job and you share like things. So you build a rapport with each other to be able to have those conversations. So you can understand work-related stress, you can understand work-related challenges. And so when I'm going to bring those home at the end of the day, I might not find that same level of support. I know in my roles prior and in my current role, I will often find people that need somebody to talk to, or they are going through a different situation, and we need to have those conversations to be able to bridge that. So what can we really do? Everyone always talks about mental health and creating a great work environment, but what does that really mean? What I challenge you to do is take a look. Take a look at how you respond to an accident or an incident. Take a look at how you respond to mental health challenges. I am an EMT, so I often I show up for both cases, mental health challenges and people's physical ailments, such as I broke my arm or I cut my hand. Often when we are in the situation of I broke my arm, I cut my hand, we're more apt to have more support for those situations. We've thought of those. We've figured it out. We have a first responder team that's going to check on people and make sure, hey, you need to go see a doctor and we're going to help you get through this type of scenario. We need to do that same kind of have that same level of training. I'm a CPR trainer. I understand that, but I'm also a mental health first aid trainer, where I challenge companies to think about, what are you doing in order to ensure that employees know how to have these conversations with each other? I met lots of leaders in my course of time that having a conversation about mental health is a big challenge for them. They may have come through, I know years ago, there was a different philosophy, pull yourselves up by the bootstraps and get going. We have work to do. I don't have time to talk about how you're feeling about it. But we find that isn't working. With 120,000 deaths a year, that process is not working. We need to pause. We need to understand our people. We need to create systems in place, just like we have with our first responders and having people trained on first aid, to talk about these mental health challenges. And we need to present ourselves in a manner that, we all have them. We all are going to have stressors, and we need to be able to have those conversations and make it a safe place for us to be able to talk about it. So to just break it down a little bit and be able to put it in words and have things that are understandable, we created this recognize and respond to mental health. We call it Take a Sec. And SEC stands for stressed, escalated, and crisis. And those are the different levels of mental health challenges. People are going to sometimes go through these different levels, and sometimes they may just escalate quickly because we never took care of stress. So as we go through, we're going to talk about what does it look like or feel like to be stressed in this case, and then what can we do to help ourselves and what can we do to help others. So in my fire here, my nice little symbol, stress to me, and stress on how I want you to think about it, is the little yellow fire. It hasn't gotten to be a big engulfed fire yet. It is small, but it's burning. We might be starting to feel overwhelmed. We might be thinking that our balance is off, or we're starting to put in more work hours because all of a sudden, we're getting behind. I know this sounds counterintuitive, but at this point, we need to take a second, and we need to take a second and do some self-care. Our goal whenever we get stressed, and our goal for others when they're feeling stressed, is how do we get that fire truly put out? Not to a point where it's smoldering and then going to explode to the next degree the first time something happens, but how do I really put that fire out, and what can I do as actions? So here are some signs of feeling stress. I know all of us have felt stress before. So you can think about, what do you show up, or how do you look when you're feeling stressed? Not that these are all symptoms that everybody's going to have. These are just some common ones. So I might feel more irritable or get more easily frustrated. I might feel that I'm just tired and I'm having trouble like just motivating myself to get through the day. I might be calling in more frequently or not being able to come to work because I'm having a headache or a stomach ache. I have more muscle tension. You may see me try to avoid tasks, or I'm starting to miss deadlines. I'm kind of getting to a point where things seem a little upside down and I'm not able to get the work done that I've always been able to get done. And how you will know this is by paying attention. If you see a change in behavior, those are great opportunities for us to have conversations. Most of the time, people don't want to have these conversations. They're like, oh, no, I don't want to talk to people when they're stressed. I just want them to get over it. But a lot of times, especially coworker to coworker, you can be that sounding board. You can be that person that's going to help someone think through, how did they handle this in the past and what kind of tools have they put into place. So the first part of stress is just, how do we help ourselves? And in all of these cases, we have to slow down and think about, where are we really at? We have to do some self-reflecting. Like, how am I really feeling? That sometimes is hard for us to slow down to that degree. We need to build awareness to our emotions, to our stress levels, to our thoughts, and to our actions. And are we showing up how we want to be showing up? How we're showing up, does that meet with what we value? Maybe we are happy-go-lucky people, but we are under stress and we are not showing up as happy-go-lucky people. Those things can change as you're feeling stressed. This is a time where you're going to need to try to maintain and work to maintain balance across work, personal life, and leisure activities. And that sounds crazy. Like, how can I have all this work to do? I have all these personal obligations. How can I take time to do the things I enjoy to do? But if we don't take the time to do those things that we enjoy, or we get the rest that we need, these situations are not going to resolve themselves. That is just going to continue to build up. So taking time out, go fishing, go hunting, go skiing, or whatever it is that you enjoy, go for a walk, adjusting and doing those things, read a book, whatever it is, that is going to help bring some balance to your world, where you aren't all about just work and just all of your personal life obligations. You have some peace in there, and you have some time to do the things that are going to let your body rest and let your mind rest. Connect with others, express how you're feeling, lean on them for support. Many of us have people that we will call and we're like, I don't want you to tell me how to navigate this. I don't need you to help me there. I just need you to listen. And at that point, when you have somebody that you can reach out to, and it could be a coworker, it could be your HR, it could be your supervisor or foreman. But when you have those people, a lot of times you're able to put into words really how you're feeling and be able to understand, oh yeah, I guess I have been here before. This is how I've taken care of this in the past, and kind of work it through for yourself. So we want to make sure you have that ability to connect with others to be able to talk through it. And establish and maintain a daily routine. So as our worlds feel like, oh, well, now I'm working more and now I have all these personal obligations and I have all this stuff going on, at sometime we need to back it down for a little while. We need to get back to a regular routine. We need to eat supper at a regular time. We need to go to bed at a regular time. All of those things help us bring balance and help us be able to handle stress and get back to where we can cope with the daily struggles of life, of stress that we will have. So at this point, we want to look at, okay, so if I do find this time, I want to think about, how do I develop those healthy coping mechanisms? Exercise is a great one. I often will say, if somebody's feeling stressed, like, meet them for a walk. Hey, we're going to meet on Tuesday night. Let's go for a walk together. You kind of are able to do two things. One is, I'm going to be there to listen, and I'm also going to be able to walk with you and create these healthy coping mechanisms. Eating a healthy diet is really important at this time, because the more junk and the more processed foods we eat, the worse we feel, and we get into this roller coaster. We have to think about putting ourselves and prioritizing ourselves first, and practicing that good sleep hygiene. So sleep is super important. We want to make sure that we're getting the right amount of sleep for us, which might be 4 hours or 8 hours or 12 hours, whatever it is. But we need to make sure we're doing that, because the world will get on top of us even faster if we are starting to burn the candle at all ends. And then hunt the good stuff. In a day, some things aren't going to go the way you'd like them to go, but you're going to have some positive moments. Sometimes it's easier at the end of the day or during the day for us to think about all of the things that have gone wrong today and not focus any attention on the things that have gone right. So at the end of the day or throughout your day, think about, oh yeah, this went right. This was okay. The more we can look at those positives, the more we are starting to create a mindset where we have better control over our thought process, and we're not just focused on all of the negatives in the world. There's plenty of them, but what are the positives, so we can get our head into that mode as well. That will help us focus on building our own resilience. We will send this out, I believe, or put it in the chat here. At this point, I would like you to think about creating a self-care plan. And this self-care plan is just an idea of who could you call if you are feeling stressed? What are some things that you have done or hobbies that you enjoy? Because when we are feeling stressed, sometimes it's hard for us to remember, like, oh, what did I do the last time I was feeling like this? Or what were some strategies that I've already figured out that helped me through that? When we're feeling stressed, it may feel like the world is getting a little bit on top of us, and it's hard to see how we would navigate through. And having this reminder, having your own self-care plan just pinned up where you work or pinned up in your toolbox or wherever you are, to say, okay, when I'm struggling, I might refer back to this and see if there's something here that would help me navigate. So obviously we all are going to feel stressed, or most of us are going to feel stressed at some point in our life. And we're more apt to look at helping others. Our tendency, and I can see this in CPR, I can see this in EMT, I can see this as I go out and help people along the side of the road. Often other people have already stopped. Our human in us says we will help others. We do have to always pause and make sure helping others is the right thing to do, and prioritizing our own self first. which sometimes is hard, but we want to make sure when we're really showing up and helping others, we're in the mindset that we're capable and able to do that and not make our mental health become worse because of helping others, because it is a lot. So what can we do? The biggest thing is, one, get to know your people and notice those shifts in behaviors. So if somebody doesn't seem like they're right or something seems off, we want to have a conversation. And it isn't like, hey, Connie, I noticed that you are really irritable today. It might be, I'm concerned about you, I care about you, and I'm just wondering if you're okay. And I've had many of these conversations throughout my course of life, and a lot of times, or sometimes, the person isn't quite ready. They haven't even recognized this in themselves yet. So I'm like, oh, I'm just checking in, making sure you're okay. Things seem to be off. And here are some things that I noticed. And I want to be sure that you understand, giving them specifics on what you noticed, not just you're irritable, but when you said this, it seemed like, something was going on, will help them start to rewind their brain a little bit and start thinking about how they are showing up and how they are reacting. And they don't have to get defensive. The more we can do to have these conversations and talk about when we're not feeling okay, breaks this stigma. I am a mental health first aid trainer, and one of the things that I thought was very interesting when I went through that instructor course was many years ago, when cancer was first diagnosed, people were not wanting to say they had cancer. There was a stigma around having cancer, and people wouldn't have that conversation like, oh, no, I don't have cancer, because there was this stigma that if you had cancer, there was something wrong with you. And now shift, let's go to year 2025. Now, if someone has cancer, we are like, well, let's have a benefit. And what can we do? We're getting meal trains put together, whatever we can do to help support somebody going through that. We need to flip the switch on mental health and feeling stressed and getting into crisis. And how do we truly support people in those situations? And a lot of times it's just starting with a conversation and noticing that something doesn't seem right. Encourage others to share their feelings without or concerns without stigma. And we want to listen. Again, you may not understand. This might not be where your path has taken you, but don't offer that judgment. Don't say, oh my gosh, I can't believe that you'd even be thinking of doing that. We need to understand where they are, meet them where they are, listen actively, listen empathetically, show our support, and see what we can do to help them.
Connie, we have a question that I think is applicable
Yeah.
of how do you approach people who might not be ready to talk, or, how do you get them to open up to you?
Great question. So I have found in my course of time that, again, starting with real facts of what I've noticed and not just saying like a blanket statement, are you well or are you unwell? Because again, they might not be quite there. And sometimes people might get defensive about not wanting to share this information with you. Like you're not the right person for them to feel comfortable with. What I would do at that point is really encourage them to, okay, if you're not comfortable talking to me, that's totally cool. Who are you comfortable talking to? Do you have support? Do you have a friend? Do you have a coworker? Do you have family? Anyone that you could visit with? And try to encourage that and then follow up with them. So if somebody comes to talk to you, or if you're coming to talk to them because you're concerned, it can't be a one-time conversation where you're like, oh, well, I'm done. I had my one conversation, they got upset and I'm over it. Like we want to check in again. We want to make sure that, people, I've had people come back 24 hours later and said, oh, I thought about what you said and I didn't realize that was how I was showing up. And I am struggling. I am going through different things. So don't just take that first situation as like, no, I don't want to talk to you. They might not be ready. Might not be there. You might not be the right one. And encouraging them to talk to somebody else is really what we can do in those moments. So what can other actions we can do? Just like I told you guys to practice self-care, like talk to them. What do they enjoy? How are they balancing their work and life and all the priorities that we all have? And it's okay to need help, and encourage them. A lot of companies have employee assistance programs. I know all the companies that I've worked for over the course of years have had them as well. But I can also tell you, as HR, they are not very well utilized. People are very concerned that the company is going to find out that I have this situation going on, and that I'm going to have, I'm going to lose my job, or something is going to go on. So show people, teach people, help them make those calls, if you have those systems in place, as they are underutilized and people need that sort of assistance. A lot of medical insurances will cover that as well. So it is okay to need help. We all are human, and we all need people to talk to. And if we're not the right people, we need to try to get them to think about who is the right person. Again, offer to help balancing that work-life activities, or other things we can take off their plate to reduce their stress. Now, that can be a double-edged sword, because sometimes people feel then that they're not meeting your expectations, but really looking at what are their roles. There are some great surveys. I know OSHA has some surveys out there now, as they know that this is the #1 cause of deaths in workplaces, to really survey your employees. We can share those for anybody interested in those as well. But ask the questions, because it'll be interesting to see the results, and you'll really understand where your culture is around your company's support of mental health. Regular check-ins, active listening, acknowledging those challenges, not saying this is what I've done and you should do this, but acknowledging that they're working through it, and that they're on the right path. People need support. So the first symptoms, or the first section of challenges that we talked about, was stress. I'm feeling stress. For after stress, we kind of get into more escalating symptoms. We may have more trouble concentrating. We may go into mood swings. It may keep us up at night, or we may be sleeping all the time. At this point, this is where we need to ensure we engage. So stressed, we're really talking about self-care. Like, what can we do? What have you done in the past? How can we connect you? But when we get to escalating, we really need to put this fire out, because we need to make sure we're going to prevent it from going into a crisis situation. So at this point, this is engaging with professional help. So the earlier, just like we do with every other ailment that we have as a human, the earlier you catch things, the better outcome people have. People do not need to suffer with mental health conditions for 6 to 8 months before they can go see someone or figure that out. We need to make sure that we are connecting these dots and helping them get that, just as we do with other mental health injuries or illnesses, or other physical illnesses or injuries, sorry. So what does it look like if I'm starting to get escalating symptoms? And one note, it doesn't work this way for everyone, where you have a small little fire and you put it out and then everything is okay. What sometimes happens is you have a small little fire, you think you put it out, you didn't realize that it was smoldering, and then the next situation that occurred put you into escalating immediately. And it is all how we manage and cope and deal with stresses in our world. But I can tell you, if we could take that time out and really handle it at just stress, we are going to be able to do some self-care and to be able to work through it. When we get to escalating, that's where we're going to need more help to prevent that crisis type of situations. So when somebody has escalating symptoms, they may have extreme fluctuations in their mood. They might go from a very high energy to deep depression. And you may not always know this. You may see them as very high energy people. And then when they go home, they go into deep depression. And when they come back to work, they have that high energy. So really getting to know people who they are, not just who you see at work. Having conversations, people will share if you give them opportunities to do that. Maybe they have inability to focus on tasks, or maintain attention on something for long periods of time. They may become easily agitated, short-tempered, or overreact to minor annoyances. So I'm really, at this point, I'm pretty agitated. I'm like little things that wouldn't have agitated me before are agitating me. And what that could look like at work, it could look like I'm coming in early and then earlier, or I'm staying late and then later, or I'm working through my breaks. My balance is mixed up, and I'm really, showing those signs of starting to get disengaged, might be making more mistakes. Even though I'm working more, doesn't mean I'm getting the things done that I need to get done within the deadlines. It means that I'm kind of spiraling here and trying to figure out how to navigate. So how do we help ourselves? So at this point, again, we're going to pause, we're going to reflect, but we really need to engage with some professional help. A lot of times, this is something that we can get to go away short term, but it's going to come back if we don't really work through our feelings and how we're working through our world at that point. If it isn't changing, we're going to continuously be here. We want to make sure we remind ourselves we have to be patient, and it is okay to feel how we are feeling. Again, we're going to prioritize that basic self-care and making sure we are in a safe environment. One thing that happens very commonly when people get to an escalating, or even when they start to get stressed, you may see a higher intake of caffeine, sugar, alcohol, drugs to have as a coping mechanism. At this point, when you are escalating and you feel like things are a little bit out of control, caffeine, sugar, alcohol, drugs are going to make that worse. They increase our anxiety, and they're going to reduce our ability to cope with the situation. So staying away from those are a good option at this point as we are trying to navigate. We want to try to keep a journal, talk about how we're feeling. Might be this situation or that situation. What we're trying to do is understand our symptoms so that when we do talk to someone else, we do have more information about how we're truly feeling. And at this point, this is where I might need to develop a crisis plan. If I really am in a situation where it's really getting above, the world's really coming down on me, I'm not feeling good about where I'm at, I might need to think, who can I contact? What is my plan if this were to get worse? Because anytime we have different scenarios like this going on, the better job we do at thinking about it when we can prior to it occurring is a better place for us to be. So how do I help others? Again, we're going to look for those same things. Look for shifts in mood, withdrawal from social activities. If people are talking about having difficulty sleeping or changes in their appetite, or you're seeing that irritability, we want to make sure, again, approach them, offer our support without judgment. Again, respecting their readiness to talk, and don't force a solution. I've heard many people say, well, you know what you should do. But again, we are all different, and we all are going to handle our situations differently. And we need to give them the place and peace to be able to do that. Encourage professional help. And I know people are like, really, at this point? But if we can catch it at escalating, and it doesn't have to go into crisis, people have a better outcome. It is a lot easier for people to navigate and not have to suffer with this for multiple months or years before they're getting some level of relief. Again, we want to not just forget about them, like, oh, they must be fine. They talk to a professional. I don't have to deal with them. We want to check in. We want to see how they're doing, see what other support we could provide. At this point, we do want to be cognizant if somebody is talking about self-harm, or committing or dying by suicide, or showing signs of severe distress, we need to take those signs seriously. I had an employee, I was just out of college early on in my career. And I had an employee that was definitely having trouble. They were having trouble getting to work on time. They worked the overnight shift. And I had come in, I came in at 6 a.m. to just talk to them and see how they were doing. And I really had no training in how do you handle these types of situations. I had gone through college. I was like, we'll see what happens. And in that situation, the gentleman said, I can't stay and talk to you. I'd like to talk to you, but I can't right now. I have to go pick up my children and take them to school because he worked nights. His wife worked during the day. He'd take the children to school. And he said, but I will come in at 10 p.m. and we will have a conversation. I am really struggling. I believe it's night shift. I believe I'm having a hard time working the night shift and trying to figure out my schedule and how all things work. I just took it as we would talk at 10 p.m. I was there at 10 p.m. He wasn't there. About 10:15, we called the police, did a wellness check. He had died by suicide and left a note saying, I'm sorry, I couldn't talk. I just don't know how to deal with the world that's happening. So connect immediately. If you're not sure, it's okay. Like there isn't anything that can go wrong with this. This person, if they have any concerns or if you have any concerns, it is better to connect them. I would say 988 Suicide and Crisis Lifeline is a great resource and it can connect people very quickly. 911 is another very great resource. But if you are calling in to 911, make sure you tell people it is a mental health concern. A lot of the bigger areas that have ambulances will have people that are better trained for mental health crisis or mental health conditions rather than just your average EMT. So be sure if you are calling 911, say, I am concerned about their mental health and give examples. They said they were, going to harm themselves. They spoke about suicide and or they're very distressed. These are very important. It has been very hard in a challenge of thinking about that throughout my course of time and learning to navigate with different situations and different people. And I wouldn't want people to have that happen to them. And it is preventable. If I would have stepped in at the point where I knew that something was wrong, I probably would have been able to help my person that died by suicide more quickly. And it is a lot to think about. So I always say, medical help, mental help really helps the people around them as well. So not just the person going through it. Whenever you're helping others, especially as you get to escalating or into crisis situations, make sure you take a break, take care of yourself, recognize when it's beyond what you can handle, and that's okay. Getting them onto someone else, getting them onto professional help, you may be able to check in, but these can be very damaging to people's mental health, and you have to make sure you protect yourself to be able to help yourself and others. So make sure you take that time. Then as we get into the last one here, really looking at mental health challenges, this is crisis. So somebody is in severe distress. And I've had these people show up to work. I've had lots of different scenarios over my many years in industry. So the fire is out of control. They may be experiencing panic attacks. They may be having suicidal thoughts, or they're at complete burnout and they're like, I'm just done. I don't know how to do this. This is connect with help immediately. So crisis, connect with help. Get urgent help. We have to extinguish this fire. If we were to let this crisis situation continue, then we are unsure of what those actions will be moving forward. So things that you could notice, verbalizing thoughts of self-harm or suicide again. They might not be able to recognize familiar people or surroundings. They might not be able to think clearly or make rational decisions. They might be experiencing unexplained headaches, stomach problems, failing to maintain their basic own care. At this point, they're probably withdrawing from people that they've been connected to in the past. That might be family, friends, social activities, things that they enjoyed, things that they had confidence in the past. They may show physical aggression towards others. They may destroy property. They may be using alcohol, drugs. They may be doing dangerous behaviors as they are trying to figure out mechanisms to cope. I will often say, yes, it can be extreme anger, rage, panic attacks, but I've also seen the other, inconsolable crying. They're just done. They don't know what to do. They're at the end of their rope and they don't know where to go. They might have frequent disputes and confrontations with coworkers. Like, these would be things that are different, a shift in behavior, outbursts of anger or crying or emotional episodes that you haven't seen in the past. That is a good indication that there's crisis or something going on. Again, not that I'm trying to belittle or go overboard on this, but it is okay to ask someone, are you thinking of killing yourself? I know if you go back in time, it was a taboo of, like, you don't ask people these things, because if you ask them, you're putting the idea in their head and they're going to think about it. That is untrue. The reality is, if you ask them, are they thinking of killing themselves? And they say yes, they already have a plan in place. You are just now starting to understand where they're at. So often people will respond to really where they're at if they feel they can trust you. If someone is acting out violently towards others or themselves, don't let them just go, I'm just going to leave. I'm leaving, I'm out, and they drive away. We don't know what that is. I've had really extreme situations in my previous world. Obviously, I had a gentleman die by suicide, but I also have had situations where people have left the place of employment and come back. One person tried to burn down the building. One person tried to, come in and had a knife on them. So we need to address the situation. This is a mental health challenge, and we need to help and intervene. We talk a lot, and OSHA talks a lot about heat stress and different ailments that can happen, that we're not in our right mind at this point. We're not thinking clearly, and you may need somebody to intervene. Just like in heat stress situations, you may not know that you're too hot. You need somebody else to be able to recognize some of that. They may also just totally withdraw. They might not communicate. They may just shut down completely. At that point, we need to make sure that they have some level of care moving forward. How do we help ourselves? So if it is us going through this situation, accept that it is okay and you are going through a difficult time. Call a family member, a friend, someone that you can trust, and get their support. Let them know you need support. Call the mental health crisis hotline or 911. Seek help as soon as possible. Ensure your own safety. If you have something or access to something that could cause you harm, understand that at this point you're not thinking clearly and that you need to protect yourselves from those things. Go to somewhere where you would feel safe. Some people feel safe going to friends or family. Some people say, I'm just going to go to a public area where others are around, because then I know I'm going to be safe. I'm not going to do something in front of others. Focus on what you control. Really, we're looking at small little steps at this point. Like, what are the things that I have control over? Giving ourselves some ability to make choices and have some control helps us navigate how we're feeling. Focus on the next step rather than all of the steps. Your world may feel like it is falling apart, but you're taking steps to help yourself. Be kind to yourself. It is okay, and it is very strong to be able to say, hey, I am not okay. I need some help. And it is very brave. That is very much an important step. How do we help others? Again, recognize those signs, notice any drastic changes in their mood, speech, actions, listen to their words. I know as humans, we do an awful lot of Yes, I hear you talking, but I'm in my head thinking about what I'm going to say next. At this point, we need to shut that down and really listen to what's being said. That is where you're going to understand really where they are. It might be you're going to hear hopelessness, despair, thoughts of suicide, or thoughts of self-harm. Approach with care. I often will say, like, in these situations, nobody is truly comfortable. You don't really know what to do and you don't really know how to help them. You're just going to do the best you have. But really, it is important that you try to stay calm on your outside. I always refer back to like a duck in water. So, a duck moving through the water, when you look at them, they look like they're just peacefully floating along. And if you look at their little feet, they are paddling super hard in order to make their way through that water. We want to look like the calm, we're here to help. Even though our inside might feel like those duck feet spinning out of control a little bit. We want to try to de-escalate, soothe, bring down the situation, help them. Often in my ambulance world, I may have or run across an EMT that really wants to have more control over the situation. Some people's coping mechanism is to pace. And that might make you feel uncomfortable. But if you were to try to pin this person down and tell them to sit in a chair, you are going to escalate the situation. They need to have some control. They need to be able to use their normal coping mechanisms, not what works for you, but what works for them. So understand that we really want to get them to a point where they're able to calm down and try to help them navigate. Express that you care and that you're worried about them. Be non-judgmental. Allow them to express their feelings, but ensure your own safety. If it is unsafe, you want to disengage. It isn't something that you're going to put their safety before yours, but you want to make sure you're thinking about that as well. Ask direct questions. You can connect them with EAP, the mental health hotline, or a doctor or emergency care, but you need to get them connected. We can't let them walk away and think, well, they're just gonna, blow off their top and then calm down. This doesn't go away, and it might go away this once, or it might settle down to just escalated. But the next situation, you're going to be back in crisis situations. And that will continue to do that until we really work through and offer our support and figure out how to help this person navigate. So some key points to remember. We want to recognize those signs and symptoms, and we want to talk about it. If people are stressed, we can offer self-care. What works for them, not what works for you. If they're escalating, we want to engage either us or engage them with another professional that can help them. But at crisis scenarios, we don't want them to walk away. We don't want the situation to continue to go on. We need to connect them immediately with more help. So thank you. I'll have it go back to Jennifer here to talk through our poll.
Yes, we've got an end of webinar survey for you. So please let us know how we did. As we are letting that poll run, Connie, we did have a couple of questions come in.
Yeah.
One was on the line of being that person that someone trusts versus your need to maybe report it to someone else, HR. How do you balance that need to tell someone else that this person needs help, but also being that trusted source?
So it is very tricky. And as you're a leader in a company, a lot of times, our preference or what we have to tell people is, I am your support. But if it is going to escalate or you feel like it's escalating, you'd probably need to talk to HR. Often I would say, okay, this is where we're going. I want to make sure you understand talking to me. This is what is going to occur. In this case, obviously I'm here for you and I can listen. But if it gets escalated, then I will need to engage others, as it's part of my responsibility as being a leader in a company. For other people, I would say escalating. When it is to the point where it's escalating, if we don't get a good handle on it, then it is just going to continue to grow, right? So if stressed, I think we can offer self-care as long as we don't see any other more concerning signs. Anyone can talk to someone in that realm. And even at the beginning of escalating, it's just if that's going to continue on, if you feel more stress and it's lasting for more than a 2-week time period and that it's not going away, that is a good indicator that more is going on here and that we're not working through it. So give it a little time. 2 weeks is what they always say. If you're still feeling this way, then, we might have to talk to somebody else.
And then we had one other question about if you intervene and offer help to someone and call 911, are you legally exposed if that person doesn't appreciate that help or want that help? Can they sue you if you call 911 to help them?
Yeah, that's a great question. And no, even as the ambulance coming, we cannot force anybody to go with us. What you're just doing is hopefully having another conversation open up. And I can tell you, I have had my fair share of people that do get a little agitated by that process. But usually when it all boils down, and this isn't something that will happen tomorrow, but give it a week or 2 or a month, and usually they get that you are just trying to help them and we're trying things in their best interest. And whenever you approach it from, I care about you and I think it's in your best interest, and I understand you might not like this, but just talk to these guys and see how it goes. They can tell the ambulance driver, I'm not going with you, and there's nothing we can do. But you've not just said, I've washed my hands of it because they now got in their car and sped away, right? We want to make sure we're engaging. A lot of times you'll be surprised. We always hear more about the times that it is more people being agitated or want to do something, like aren't very happy with our decisions. But I can tell you over a course of time, it's been more of the opposite. As long as you really are coming from a place that you care about people and that this isn't the only time you've ever talked to them, right? Because if it's the only time you've ever said anything to this person, you are probably not the right person. You have to have a rapport. You have to build that trust. And sometimes these things take longer to do. So, you might think about somebody else. I know I used to engage different supervisors or different foremen in situations because I knew they had a better rapport, right? I have only had 5 conversations with them. This other person talks to them every day. Have that person. It doesn't always have to be you. It isn't about you always being the one. It's about getting this person help.
Yeah, thank you. Thank you for that. We did have one question about using this recorded webinar to train managers. Will you talk a little bit more, Connie, about our other offerings for mental health first aid?
Absolutely. So obviously this will be on our website and you can review it as you would like after this. So we do offer this class we do offer this class, but this is just a small version. We do offer a 2-hour where we really are more focused on scenario based and here's some things that we're noticing. So as we talk through the different behaviors or the different things that we could see, we dive more into that. And that's a 2-hour training that we do. We also do, it's about 8.5 hours, the full-fledged mental health first aid, where you put some strategies in, just as you do CPR training. This is that same kind of process, but it's all focused on strategies and tools that you can make a toolbox out of for mental health challenges. And that one's mental health first aid.
Yeah, so good opportunities, a wide variety of opportunities for people if you want to use this and have other topics for your people as well.
Yes. The mental health first aid, just to broaden that a little bit, is really designed as anybody could take it, right? It is done by an organization where we're certified to train. So that has scenarios and we work through different things as well. The mental health for the workplace, the 2-hour, is really focused on what do I do if this happens in my job site? Or what happens if this happens in my workplace? How would I navigate it? And how is being a supervisor or HR or safety, what is our plan, or how would we go about situations? So that's the differences.
Yes. Thank you. Thank you for sharing those.
Yeah.
I think that is it for the questions that we've received. So thank you very much. Connie's information is there on the screen. Please reach out to her if you have any other questions, or check out our website for more information on our classes and other opportunities. We've got another webinar coming up in May, and this one is talking about being the general contractor, what's required, what to know. And we've got Dwayne and Josh presenting that, so we hope you join us. You can sign up for that on our website, and it will also be coming in emails. And just a reminder that we are your total safety solution. OECS is here to support your safety needs. And so please give us a call, talk to us about what your needs might be, and we will help you find a solution. And then I did just want to end with thanking our partners once again. Thank you so much for promoting our webinars and helping us to provide these. We'd like to thank TSSA, MPMA, SCSA, BIA of the Red River Valley, ABC of Minnesota, North Dakota, NRASP, Build Connection, and the Lake Area Manufacturers Alliance. Thank you all so much for joining our webinar. We appreciate your time. Have a great day, and we'll see you in May.